Today, I'm diving into the top common medical emergencies that can happen in a dental setting, and I'm challenging myself to identify how to handle each one like a pro. As a dental professional, you've got a lot on your plate, but one of the most critical things you need to be prepared for is a medical emergency. These emergencies can happen at any moment, and being ready is crucial not just for your patient's health but also for your own peace of mind. Think about it, you're working on someone's teeth, and suddenly, their heart starts racing, or they're struggling to breathe. It's terrifying, right? But with the right training and protocols in place, you can be the hero in that situation. Dental practitioners face a unique set of challenges when it comes to medical emergencies. For one, you're working in a relatively confined space with a patient who's often reclined and sometimes under the influence of anesthesia or sedation. That makes it harder to respond quickly and effectively when an emergency pops up. Plus, you've got to think on your feet and make split-second decisions that can mean the difference between life and death. And let's not forget, you're not just dealing with the emergency itself, but also with the anxiety and fear that comes with it, both yours and your patient's. Another challenge is that dental emergencies can be really unpredictable. You might have a patient who's perfectly fine 1 minute, and then suddenly, they're experiencing a severe allergic reaction. It's why having a solid grasp on common medical emergencies and knowing how to respond is essential. You're not just a dentist, you're also a first responder in many ways. It's not just about knowing what to do, it's also about being prepared with the right equipment and having a clear plan in place. That means having emergency kits stocked and easily accessible, and making sure you and your team are trained to use them. It's a lot to think about, but trust me, it's worth it. Allergic reactions, fainting, cardiac events, these are just a few examples of the medical emergencies that can happen in a dental office. An allergic reaction might occur if a patient has a sensitivity to a material or medication used during treatment. Fainting, or syncope, is often caused by anxiety or pain. Cardiac events, like a heart attack or stroke, are less common but can be devastating if not addressed quickly. Each of these emergencies requires a different response, which is why training is so critical. You need to know how to administer epinephrine for an allergic reaction, how to help someone who's fainted, and how to respond to a heart attack. The good news is that most dental emergencies can be managed effectively with the right training and equipment. It's all about being prepared and knowing what to do when the unexpected happens. I've heard some crazy stories about dental emergencies, but one that really stands out was about a patient who had a severe allergic reaction during a routine procedure. The dentist and her team sprang into action, administering epinephrine and oxygen, and even calling for backup. It was a dramatic moment, but because they were trained and prepared, they were able to save the patient's life. The patient made a full recovery, and it's a testament to the importance of being prepared for anything that might happen in your chair. It's stories like these that remind us just how critical it is to have protocols in place and to stay vigilant. So, what can you do to prepare for medical emergencies in your dental practice? First, make sure you've got a solid emergency plan in place, including protocols for common emergencies and a well-stocked emergency kit. Second, get trained and stay trained. Consider taking courses or attending workshops on dental emergency response. Lastly, stay calm and focused. It's easy to panic in an emergency, but your patients are counting on you to stay cool and save the day. To wrap it up, medical emergencies in a dental setting are unpredictable but can be managed with the right training, equipment, and mindset. By being prepared and knowing what to expect, you can be the hero in a crisis and make all the difference for your patients. If you've had any experiences with dental emergencies, I'd love to hear about them. Drop a comment below and let's get the conversation started. Don't forget to subscribe for more videos on dental topics, and hit that notification bell so you never miss a new upload.